Okay, good morning everyone. So our lesson today is inferring how one's lifestyle can affect the functioning of the respiratory and circulatory system. So part 1. So we are going to talk about the diseases of the respiratory system today, as well as the circulatory system. Our lifestyle and our exposure to viruses or bacteria and other environmental pollutants may increase or our susceptibility to respiratory diseases. That's it. So, ngayon is we have to wear masks, right? We should at least follow the standard health protocols made by the government in order for us to uh, prevent the exposure from the different diseases from the outside environment. So, take note, class, that these diseases may prevent respiratory system from functioning well. So, kapag hindi nag-function ang iyong respiratory system, and take note that respiratory system is one vital part or one vital or organ system of your body, maaari mo itong ikamatay. So magsimula na tayo ngayon. Ang una nating tatalakayin ay about common cold. Okay? So, lahat tayo nakaranas ng common cold. And common cold is characterized by sneezing, runny nose, due to nasal congestion and mild fever. So it is caused by viruses infecting the upper respiratory system. So, take note class that common colds are caused by viruses. So it's just attacked or it infects only the upper part of our respiratory tract. So when we say upper part of our respiratory tract, we are pertaining to our nasal cavity towards our trachea. So that includes the upper respiratory system, okay? So take note that common colds only last for a week or more than a week. And the treatment of this is to take enough rest and drinking lots of fluids. Also, kapag hindi naging okay yung karamdaman mo, you have to seek proper medication treatment and cover the mouth when coughing or sneezing to prevent the virus from spreading. So, a very good example of this is today, okay? So, bakit kaya kailangan nating magsuot ng mask every time na lalabas tayo or uh, every time na makikipag-usap tayo sa ibang mga tao? Dahil maaring tayo ngayon ay carrier ng tinatawag nating COVID-19 virus. So, hindi natin alam at hindi natin nakikita ang virus na ito. Kaya, ang standard protocol ay magsuot dapat tayo ng mga mask. Okay? So, kapag nagsuot kasi tayo ng mask at ikaw ay isang may sakit ng common cold, you prevent to what do you call this, maaari mong hindi maipasa yung sakit na yun sa mga ibang taon na healthy pa. So, next is the influenza. So, in the other words, influenza can be called flu. And flu is characterized by chills, fever, severe headache, muscular pain, runny nose, and fatigue. So it is caused by influenza virus or may come from the birds or swine. So another form of viruses or uh, virus caused by diseases is the influenza. Okay, so influenza may be transmitted from the birds and swine. So, halimbawa nito is yung birds, yung bird flu na tinatawag. So, halimbawa, kapag nagkaroon ng bird flu, you're not allowed to eat any bird. Okay? So, halimbawa nito is yung mga chicken, yung mga bibe, lahat ng klase ng bird kasi they may carry these kinds of diseases, as well as swine. We have the swine fever. So, kapag halimbawa na-detect ng ating detect na merong swine fever, we are opt to eat this we are opt to eat yung mga meat, okay? So, ang maaari lamang natin kainin ay yung mga isda at mga gulay. So, take note class that the duration of the flu may last for 2 to 5 weeks. Oh my god. So, that's around 1.5 months. So, in severe cases, flu can last for more than a week and can lead to pneumonia. So that's it. So magiging pneumonia yung sakit na flu kapag hindi naagapan. Okay? Kaya dapat kapag nagkaroon ng influenza virus ang isang tao, agad-agad dapat siyang magpakonsulta sa doktor para at least maagapan at hindi ito lalala. Ang treatment ng influenza virus or influenza flu is enough rest, drinking a lot of fluids or water, and taking antiviral medicines and vaccine. So take note class na until now, balik tayo sa COVID-19, hindi pa natatapos yung mga trials ng vaccine or yung mga vaccines kasi they are under research pa lamang. Kasi mahirap na i-treat yung virus kasi ang virus ay nagiging parang ang virus kasi is maaalis lang siya sa katawan natin. Wala siyang halimbawa wala siyang gamot, okay? But other virus causing diseases have can be cured, okay? So maaari nating ma-prevent yung pagkalat ng virus through or maaring hindi ka magkaroon ng flu kapag ka nagpaturok ka ng vaccine. So kailangan mong magpa-vaccine nang sa gayon, ikaw ay hindi matamaan ng ganitong klaseng sakit. Okay, natapos na tayo sa, ano yung una nating natapos? So, ang una nating natapos ay cold, caused by virus. Tapos na natin ang influenza. Next is pneumonia. So, take note class na kapag hindi naagapan ang flu, maaring ito ay maging pneumonia. At ang pneumonia is an infection of the lungs. So, it happens when the alveoli becomes inflamed and filled with fluid which is caused by bacteria, virus, fungi, or protozoa. We have discussed that alveoli is the site of gas exchange. So, dito, si alveoli lamang ang nagbibigay at naghahatid ng oxygen through sa ating circulatory system, sa ating blood upang sa ganun yung blood ay maikalat sa buong katawan natin. Pero kapag ang alveoli natin ay nasira, nalagyan ng bacteria or nagkaroon ng bacteria, virus, fungi, or any protozoa, maaari tayong magkaroon ng ubo, chest pain, fever, and difficulty in breathing. Kasi nga, bakit nahihirapan tayong mag-breathe? Kasi yung lungs natin ay meron ng mga bacteria. Okay? Bakit nagkaroon sila ng bacteria? Ito yung pag-accumulate ng phlegm doon sa loob ng ating lungs, okay? Kapag halimbawa nalagyan ng bacteria doon at nag-accumulate silang lahat, hindi ka na maaaring hindi ka na masyadong makakahinga. So ganun din ang nangyayari ngayon sa virus yung COVID-19 victims natin. Whereas yung lungs nila ang unang natatamaan. Kapag kasi ang lungs which is one of the vital organ of the body ang natamaan, then ang magiging ganap nito is hindi ka maaring huminga ng maayos at it may lead you to death. Okay? So The treatment can take the treatment of this disease take all is that you have to consult your doctor, and you have to take all the prescribed medicines that was given to you by the doctor. So take note, class, that pneumonia can be confirmed via chest x-ray accompanied by blood test. So basically, kapag ka nagpa-chest x-ray ka, makikita doon na kung medyo na halimbawa may tubig yung iyong lungs. Siyempre, kapag nagkaroon ng tubig or may mga bacteria na nag-accumulate or mga viruses doon, makikita yan sa x-ray machine, and then they could say na meron kang sakit na pneumonia. So that's it. So natapos na tayo sa common cold, sa influenza, pneumonia. So we are number 4. We are down to number 4, which is tuberculosis. So alam na natin to, tuberculosis in the other word is TB. And it is a chronic disease caused by Mycobacterium tuberculosis. So, kapag sinabi natin tuberculosis, it is caused by bacteria. Kapag sinabi natin common cold at influenza, it is caused by virus. Kapag sinabi natin pneumonia, it is caused by virus, protozoa, fungi, and other different bacteria. So, Mycobacterium tuberculosis, which can be transferred from one person to another through coughing and sneezing or spitting. So it is very dangerous to what do you call this? To be with a person who has tuberculosis, kasi maaari kang matamaan nito if they are not in if they are not wearing any protective apparatus. Okay, the signs and symptoms of tuberculosis are the following. So number 1, we have severe coughing with blood. Okay, that's it. So bakit may blood na yung kwan mo? Kasi ang unang matatamaan sa tuberculosis mo ay ang iyong lungs. So take note, class, that the lungs, doon nagkakaroon ng gas exchange, at doon natin makikita ang mga capillaries, at ang capillaries nito, sila ang nagtataguyod ng blood or kumukuha at nagdadala ng blood throughout our body. So maaring lumabas doon ang blood. Next, we have weight loss, kasi kapag nagkaroon ka ng tuberculosis, at some point wala kang ganang kumain. Okay? Next, we have fatigue, fever every afternoon, loss of appetite, pain when breathing or coughing. So, yan na yung sinasabi ko kanina. Kapag halimbawa nagkaroon ka ng sakit na ito, talagang mahihirapan kang huminga dahil it is a disease of the respiratory system. So we are done with number 4, which is the tuberculosis, but let's talk about its prevention. So prevention, people with TB should use his own utensils or eating utensils. Yun na nga ba ang sinasabi ko, kasi hindi mo alam kung hindi mo nakikita yung isang bacteria, kasi it is a microorganism. So dapat kapag may TB ang isang tao, they should use their own utensils. Dapat exclusive lang sa kanila yung mga utensils na yun. Dapat nga lahat ng mga bagay na ginagamit ng tao na yon, halimbawa, ay separated from their family, kasi they may maaari nilang mahawaan yung kapamilya nila if ever. Okay? The cure of this disease is proper medication for at least 6 months. Ito yung tinatawag natin na meron na tayong TB dots. Okay? So, maaari kayong kumonsulta sa ating pinakamalapit na rural health unit upang sa ganun ay kayo ay mabigyan ng pansin at mabigyan ng karampatang pag-aalaga. Okay? At mabigyan ng tamang gamot. Okay? Next. So we are done with number 4. So let's proceed with number 5. We have asthma. So alam ko marami sa inyo ang may sakit na asthma because ang asthma ay sakit pang mayaman. Joke lang po. So asthma is a chronic and allergic condition. So halimbawa naka-inhale ka ng ibang klaseng parang maliliit na dust or any pollen object na napunta sa respiratory system. So it may irritate your respiratory system at kapag na-irritate yon magsiswell at later on hindi ka na makakahinga. Okay, signs and symptoms. Okay, yon, breathing difficulties, tama. So breathing difficulties, hindi ka masyadong nakakahinga ng maayos. Next, shortness of breath. Okay, next, coughing. Siyempre, bakit tayo umuubo? Kasi gusto nating ilabas kung ano man yung nasa loob ng ating respiratory system. Kasi kapag napasukan ng foreign object ang ating respiratory system, the respiratory system itself or the organs there are irritated. At kapag nairita yon, it causes for us to cough. At kapag hindi na ilabas, magkakaroon ng accumulation of fluids. At ito na yung tinatawag nating phlegm. Okay? So, later on, papag-usapan natin yan. So, take note class that asthma is caused by, it is caused by undetermined. But, most of us, they are, what they call this, parang, it is caused by, allergic reaction from what they call this, yung mga dust, ganun, or pollen, small particles. So, they can be triggered by inhalation or dust, pollen, and fur, and they can be relieved by eliminating and triggering the agents or using bronchodilator. So, halimbawa, isang tao ay nagkaroon ng asthma at halimbawa, naka-inhale siya ng dust, pollen, or fur from the, syempre, they can be relieved or they could just be matitreat lang yun kapag ka naghalimbawa nag-inhale sila ng bronchodilator or ano ang tawag nito or yung inhaler, meron silang ginagamit na inhaler. Okay, we are done with asthma. So, let's proceed with bronchitis. So, kapag ka nakarinig kayo ng tis, okay, ganon, meaning to say, it is the inflammation. Okay, kapag sinabi natin inflammation na maga, okay? Bronchitis is the inflammation of bronchi. Alam naman na pancreas, di ba? It is usually caused by virus and bacteria, but can also be triggered by industrial pollutant and tobacco smoke. So, basically, yung bronchitis, natitrigger siya sa paghit-hit ng sigarilyo. That's it. So, kapag hit-hit ka ng sigarilyo, at halimbawa, masyado ka ng maraming hit na sigarilyo, syempre, mamamaga ang iyong bronchi organ. So, kapag namaga yun, it is a bronchitis. So, bronchitis is characterized by cough, with phlegm and difficulty in breathing. So, basta kapag respiratory system ang pinag-uusapan, ang main symptoms nito is difficulty in breathing. Okay? Next. So, we have two types of bronchitis. We have the acute bronchitis and the chronic bronchitis. So, kapag kasi sinabi ng acute bronchitis, it lasts only for 1 to 3 weeks and the treatment for this is enough rest and drinking lots of fluids only. But, kapag halimbawa hindi yun naagapan or hindi ka talagang patuloy ka pa rin sa pag-inom ng alak at paghit-hit ng napakaraming sigarilyo, it lasts for 3 months or more and it can lead to production of excessive mucus and infection from microorganisms. So the treatment for the bronchitis is only antibiotics and proper medical attention or any prescribed medicine from the doctors. Okay, so next. We have the emphysema. Okay, emphysema is a chronic disease where the alveoli as well as the breathing passages are damaged due to the prolonged exposure to tobacco chemicals and air pollutant such as fumes and coal. Okay, ito yung kung nakikita nyo sa sigarilyo na yung lungs niya ay naging itim na. So that is emphysema. So people with emphysema suffers from difficulty and pain in breathing since some parts of their lungs are damaged. Yes, that's it. So these damages cause difficulty of getting enough oxygen as well as eliminating carbon dioxide. Kasi kapag ka nasira na ang lungs mo dahil sa sigarilyo or dahil sa air pollutant na yan, syempre, hindi ka makakahinga ng maayos. At kapag hindi ka nakahinga ng maayos, maaapektuhan ang lahat ng mga organs mo sa katawan. At kapag naapektuhan silang lahat, magmamalfunction sila. At kapag nagmalfunction sila, mamamatay ka na. Okay? Ganun lang kadali yon. Okay, so emphysema has no treatment but its progression can be slowed down when the patient stops smoking. So, kung may nalalaman kayong kung may mga kamag-anak kayong addict sa sigarilyo, sabihan nyo sila, okay? Mag-post kayo ng poster na bawal manigarilyo dito kasi it could harm your health. And take note kapag mas grabe yung mga second, what they call this, inhalers natin. Yun ba yung tamang term? So, mas naaapektuhan yung mga yung mga secondary smokers na tinatawag kasi sila yung nakakalanghap ng sigarilyo. So, using bronchodilators and antibiotics, oxygen supply, and surgery to remove the damaged tissue might help. Okay? So, that's it. So, next is we have the chronic obstructive pulmonary disease or yung tinatawag nating COPD. So, COPD is term used for people suffering from any combination of the following lung diseases: emphysema, asthma, and chronic bronchitis. So the patient that acquires emphysema has no treatment available. So, sabi ko nga, may tumatawag. Wait lang, sagutin lang natin yung tumatawag. Hello po!
Ano na?
Ay, wait lang po. At nagre-record ako. Mamaya.
Andyan si ano?
Wait lang. Aguri ka. Patalastas yon, grade 9. Okay, that's it. So, yun nga. So, we have chronic obstructive pulmonary disease. So, wait lang, Sir Julius. I-edit ko na lang ito mamaya. Ano na yun? So, that's it. So, when we say chronic obstructive pulmonary disease, we are pertaining to the combination of the different diseases I've given to you. We have the emphysema, asthma, and chronic bronchitis. So, take note, class, na walang gamot ang emphysema. So, kapag yung lolo nyo or any kamag-anak ang kapag nakakita kayo ng mga kamag-anak nyong sigarilyo, stop them kasi mamamatay sila ng maaga. Yun lang ang sasabihin ko. Okay. People with COPD may increase difficulty in breathing due to long-term obstructive of airflow. The possibility of the pulmonary infection may be slowed down using antibiotics. Pero, mag-antibiotics ka pa ba? Kung may sakit ka na, wag na. Prevention is better than cure. O, diba? Tama ako. So, COPD is caused by tobacco, including the second-hand smoker or the secondary smoker. Thus, smoking should be stopped. So, stop smoking. Stop smoking. So, next, we have the lung cancer. Lung cancer can be acquired from the long-term exposure to tobacco smoke. So, kapag halimbawa, hindi nagwagi si emphysema sa'yo dahil sa paninigarilyo mo, ang magiging cause ng iyong sakit or pagkamatay ay lung cancer. So, alam na natin ang tungkol sa lung cancer. Tobacco containing carcinogenic chemicals which cause uncontrolled growth of tumors. These tumors can occupy the space in lungs which is supposedly used for gas exchange. So, ano nga ba yung kaibahan ng emphysema and lung cancer? Ang emphysema kasi, masisira lang yung parts ng lungs mo. So, kapag nasira yung parts ng lungs na yon, dahil sa mga bacteria ganon, hindi na siya masyadong function well, right? Kapag ka naman lung cancer, nagkakaroon ng production ng tumor. Okay? Nagkakaroon tayo ng tumor dahil sa mga carcinogenic na nailalagay sa loob ng ating lungs sa pamamagitan ng pag-i-smoke. Okay? Next. Okay, we have also the symptoms. When we say symptoms, coughing with blood, mucus production, weight loss, shortness of breath, blockage of airway. So, to cut the story short, hindi siya makakahinga ng maayos at kapag hindi siya nakahinga, mamamatay na siya. Okay? The treatment of this is chemotherapy. Okay kayo, kung gusto nyong mag-chemotherapy, yan, humit-hit kayo ng sigarilyo. Okay? Kung gusto nyong magpa-radiation, kung gusto nyong mag-removal of damaged part, sige, humit-hit kayo ng sigarilyo. That's it. So, next is diseases from the respiratory system or can be prevented by first, avoid smoking. Kapag nakita nyo yung kapamilya nyong nag-i-smoke, palayasin ninyo sa bahay ninyo dahil hindi sila nakakatulong sa inyo. Kasi nagdadala lamang sila ng sakit. Tama ba ako? Oo. So, next, wash your hands often. Bakit natin kailangan mag-wash ng hands often? Kasi dito, may mga bacteria na na-accumulate yan dahil sa kahawak natin sa iba't ibang parts ng ating environment at hindi natin nakikita yung mga bacteria yon. So, we should always wash our hands. Paano? Okay, gumamit ng sabon at always use alcohol. Kasi kapag halimbawa na ilagay mo ito sa nose mo, nagkulangot ka, syempre yung bacteria pumasok sa katawan or yung virus, so maaari kang ma-infect. Next, restricting from going to a place where you can expose to too much and pollutants. Kaya bawal ang gathering today because of the high risk of COVID-19, right? So, bawal lumabas-labas ngayon at you should stay at home. Okay? Then, you should always take enough rest. Okay? Kung problema ninyo yung paggawa ng module na yan, okay, do it in yung time mismo ng yung module nyo, okay, or yung time mismo ng paggawa. Okay, at night you should be sleeping already dahil it can really help you to stay healthy. Okay? So, next is the summary of this. So, the respiratory system or the respiratory diseases are usually caused by exposure to bacteria, viruses, and environmental pollutants such as tobacco smoke, coals, and fumes. Some respiratory diseases could be relieved by just enough rest and drinking a lot of water, okay, while some require serious medical treatment, and we can also improve our lifestyle to space ourselves from respiratory diseases. Okay, basahin nyo na lang yan mga anak dahil magagaling naman kayo. Okay? So, that would be all. Ay, hindi. Another summary is that diseases of the respiratory system are the following. First, we have the common cold. Okay, the common cold are caused by virus, right? We have influenza caused by virus. Pneumonia caused by what? Virus, fungi, bacteria, and protozoa. Next, tuberculosis. We have it is the Mycobacterium tuberculosis, something like that. Okay, we have asthma. It is caused by it is triggered by dust, pollens, and fur. Okay, fur. Okay, we have bronchitis. Syempre, kapag sinabi nating bronchitis, inflammation of your bronchi part in your respiratory system. Emphysema, damaged part of your lungs dahil sa kakahit-hit mo ng sigarilyo. Okay? Next is the chronic COPD. Okay? Kapag chronic COPD, it is a combination of bronchitis, emphysema, and asthma. Okay? Next, we have the lung cancer. It is caused by tumor. Okay? Kapag lumaking tumor sa loob ng yung lungs, then tapos na yon, mamamatay ka na. So, okay? Good night, everyone. Thank you very much. Natapos na. I love you all.